Welcome this afternoon to our webinar to discuss the changes to the Blueprints website. My name is Brian Bumbarger. I'm the Director of the Evidence-Based Prevention and Intervention Support Center here at Penn State. We're happy to have Sharon Mihalik with us this afternoon. Sharon is with the Center for the Study and Prevention of Violence at the University of Colorado. And we're going to have Sharon spend about 30 minutes walking us through the new Blueprints website, showing us around. And then I'm going to spend about 30 minutes giving a little bit of the history and context of the Blueprints work in Pennsylvania and talking about how the Blueprints website can be used, has been used in the past, and how it will be able to be used in the future, and talk about some things that are on the horizon. And then we'll have, hopefully we'll have about 30 minutes for questions and discussion from the participants, which you can type into your chat screen that you'll see on the side of your screen there. So with that, I will turn it over to Sharon Mihalik. Welcome, Sharon.
Okay, so I'm going to go through the website. So since we have 30 minutes, I'm going to try to go through this pretty quickly. I want to start with some of the top menu bars and quickly go through those. The About Us basically just gives a little bit of information about the center, and then you can find a lot more information on these frequently asked questions. So if you want to know even about criteria or what's model, what's promising, there's a lot of information on the frequency asked questions. The Assess Needs page. In Pennsylvania, you've done a lot of assessment upfront to determine risk and protective factors. So that's basically what this page is about. It gives 3 different types of surveys that people can use to help assess their needs. There's a couple of surveys by the Annie Casey Foundation, the Communities That Care survey that Pennsylvania heavily uses, and then our own center here has a school climate survey that we use. So these things are available for people if they want them. The Blueprints criteria page, we list here our criteria, and what I might state about this is that Blueprints has the most rigorous standard in the field. You may all be familiar with several of the registries out there, but I think that Blueprints actually sets the highest standard and is really, it's probably the most difficult registry to get onto. Our criteria is briefly listed right here. We have full Blueprint standard listed here if you want it. But basically, we're looking at intervention specificity for all programs. In other words, what is the program designed to change? What are the outcomes it's designed to change? What are the mediating risk and protective factors it's designed to change? What is the population? The main thing, of course, then that we're looking at is the quality of the evaluation. So for a promising programs require 1 high-quality randomized controlled trial or 2 high-quality quasi-experimental evaluations. So this is slightly different from our old criteria. In our old criteria, Blueprints only required, at a minimum, 1 quasi-experimental design. So this criteria now is a little bit more rigorous for promising. For model programs require 2 randomized controlled trials of high quality, or 1 randomized controlled trial and 1 quasi-experimental design, also of high quality. And model programs also have to show sustained effects at least 1 year post-intervention. So when we're talking about that quality and we're talking about high quality designs, it's not just the fact that it has a randomized controlled trial. We look at a lot of design issues. Some of those can quickly be examined if you look at our criteria checklist. This is actually a checklist that our graduate students use when they write up each study. of an evaluation. And they're looking at a number of different things here. They're looking at the measures and whether they're valid, reliable, and whether they're independent. We're looking at whether the analysis was an intent to treat analysis, whether, in other words, whether they followed and analyzed all subjects as assigned to their condition. We're looking at baseline equivalence between treatment and control groups. We're looking at attrition and whether the analysis did a differential attrition analysis. So there's a number of things here that people, when they're doing their own evaluations, could look at to make sure that they're paying attention to these items. So also then, of course, we want to see an impact on the outcomes of interest for blueprints. And this is a change more recently for Blueprints too, because we are now funded by the Annie E. Casey Foundation. And as part of their funding, they asked us if we would expand our outcomes that we look at. In the past, we were called Blueprints for Violence Prevention, and the outcomes that we examined were violence, delinquency, drug use. Today, we're also focusing on positive youth development. So we're looking at positive relationships, we're looking at academic success, and some mental and physical health outcomes, such as depression, anxiety. We're looking at obesity. So a few of those types of outcomes. And then the last criterion that all of these programs also have to meet is dissemination readiness. In the past, we did put programs on the list that weren't necessarily ready for dissemination, but we had them on our Blueprints list because we thought they'd met quality standards, and we thought it would be helpful for others in the field if they were designing programs that they might see, something that was evidence-based and put it into a design of their own program. Today, to be on the Blueprints list, the program has to be ready for dissemination. So we're looking at whether the program has training and TA, a system for quality assurance, whether they have manuals. These 4 types of criteria every program meets. So that's kind of the new Blueprints standard. I'm going to skip these 2 for the time being and go quickly to nominate a program. And this is just where you can send your own evaluations if you want us to look at a program to see if it would meet Blueprints criteria. The unique thing about Blueprints is that programs are not all nominated as they are on some lists, and some lists only ask for maybe 2 of their best studies. For Blueprints, we actually go out every single month. We do a search of the literature. We do keyword searches on a lot of different variables. And every month, we're trying to find any types of evaluations of programs that meet our outcome criteria, our outcome variables that we are assessing. Sometimes people do submit programs to us, and we'll review those. And then on our resources page, you can go to CSPV publications. Here, our center publications. We have a lot on school violence, and then we've started listing some of the stuff that we've done specifically in our Blueprints project. But more importantly, we have a matrix out here, and this matrix shows how programs have been rated over several different agencies. Most of these are federal agencies, and some are private. But you can see they're listed in alphabetical order. And if you're interested in a program, you might want to go and see how it rates on all of these different agencies. For instance, this program here, Basics, it's a model program on our list. On the SAMHSA list, they do a numerical rating of the evaluation quality. It's effective on communities that care, exemplary on another, effective. So you know that this is a program that's rated pretty highly and is probably a pretty good program. At the bottom of the list, you can see how each of the agencies do rate, and you can see what is top tier. In other words, is promising their second level of rating, or is it their top one? So you can see like top tier, near top tier on the Coalition for Evidence-Based Policy. You can see that Blueprints rates model and then promising programs. We also have more detail on this in this criteria document, where here we list the criteria for each agency and how they're rating their programs. I want to look now at some of the Blueprints programs. And here you can see that we've got right now 44 programs that are model or promising. These are listed right now in alphabetical order, but if you wanted to see them by model first and then promising, you could click here and get all the model programs first. But if you notice here, we have, first of all, on these programs, we have a very brief summary of each intervention. And then this column here, this is the impact of the program. These are the outcomes that this program has been successful in changing. Okay, so these have all been found in the evaluations we've seen. These programs have had an effect on each of these outcomes. If you look here, you can see that we've got benefit cost information, and I do apologize, we just recently moved our information over to Rackspace, and in the process I see that we're missing the cost information, and I noticed that right before the webinar and asked our programmer to get it on, but I see that he wasn't able to do that. But it will by the end of today. You can see that it has the information typically on program costs right here, and then the benefits of the program per individual. And then this column, this row here is the cost benefit value. So you can see how much money you're going to save by implementing this program. Also, you can click on target population here and find out who this program targets. In this case of MST, it's an indicated prevention program for early adolescence, middle adolescents, and so it's middle school and high school level kids. And then race, gender details right there. And then we have a program fact sheet on each program. So this fact sheet, the top part has information on, again, the outcomes that have been found in this program, the type of program, settings, information about the population the program targets, endorsements by other agencies, program information contact, and then the program developer. And here we just put the name and their university. We don't put the contact information right here only because we feel like they may not want to be bombarded with the questions that this person may be getting. But we do have this in other places on the website. We have a brief description of the program. Again, this is brief description. We have outcomes, brief outcomes of the program. And then we have something kind of unique on here that a lot of people don't have on their website. We have information on race, ethnicity, gender details. So if any of the studies give us information that we can put in about if it's been effective specifically for a race or ethnicity, or specifically by gender. In other words, maybe they tested an interaction in their study and found that it worked for males but not for females, or you know, in a lot of these studies they find that it works equally well for both. But we will put that information briefly in here. The rest of these categories are collapsible. You can get information on the risk and protective factors, and then if there's a logic model for the program, you can get information on that. We have information on training and technical assistance. So this provides you with kind of a brief synopsis of their training model, how many days you're going to go to training, what's involved in training. And then if there is a certification process for the program, it'll be at the bottom of this. So some people, you know, will have certification for their trainers or for licensure. In the case of this program, it would be for licensure of sites. We have the brief evaluation methodology down here. In this case, again, it's very brief. We're talking about 23 evaluations. So we're trying to describe that very briefly. In programs where, we might just have 2 evaluations, you'll see more detail here about each evaluation design and the number of kids that were involved in it, and more information. But for a brief evaluation methodology, we just can't do that when we have 20 plus studies. And then we have the references section. We also, for every program, have a fact sheet on program costs. So you can see here that we have startup costs for the program, intervention implementation costs. We have fidelity and monitoring costs. And then we do a year 1 cost example because a lot of people want to know what it costs to get this program started. So in this case, our example is with an organization setting up 2 MST teams, each with a supervisor and 4 therapists. They'll serve 132 families. You see the total cost, and then you see that at a unit cost, we're saying that this program costs per family $7,068. We have a fact sheet on funding strategies, and this can give people who want to implement a program ideas on the use of different strategies. Perhaps they're at the state or local level, or they're federal level, or foundation grants. So any type of information that we can pick up on this will be provided and put into this funding fact sheet. And then now you also have access to our detailed write-ups. All of the information that we show on the website actually is in our database in this write-up. Some of the information that you've already seen, such as age and things like that. We have information here's like on mediating effects, generalizability, effect size, limitations. But we actually do write up every single study of a program. So here you can see study 1, study 3, study 4. It goes on ever how many studies we have of this program. Here's a Norway replication study, a Canada study. Then we go into some pilot studies of adolescent sexual offenders, so we have a few of those. So, in some cases, we have 20 plus studies in these write-ups. So you have access to all of that information. And then if we were able to locate a video on the program, you can click out and see that video. Okay, so that's kind of what all of these fact sheets look like. I'm going to go now back to the home page so that I can show you the program searches now. First of all, you can do a keyword search. So if you're searching on something, you could search on the name of a program and bring up your specific program, or you might want to search on maybe a generic factor like bullying. If you searched on bullying, what comes up are 3 programs. 2 of these are actually bullying programs. One of them, Incredible Years Teacher Classroom Management, comes up. It's not a bullying program, but they actually, within their program, they set some classroom rules around bullying. So that's why that would come up there. So there's 2 ways, again, to use our search. One, it says there's a step-by-step process. This step-by-step process would probably be used by someone who is a newcomer to the website, is not familiar with it, and really does not know how to search. Going through the step-by-step search would kind of drive me crazy. So we also allow persons to skip the step-by-step and go directly to the selector. If you go directly to the selector, you have all of your search categories over here, and you just unfold one to see program type, or you unfold age to select on age. But we're actually going to go through the step-by-step so that I can show you each one of those categories. Okay, So let's select, in our first step, we're going to select behavior. We're going to search by program outcomes, and let's search by behavior and education, and then continue. So you see when you search by one of those domains, it brings up all of the different behavioral outcomes that we tend to look at, or the educational outcomes that we're looking at. In this case, let's just search for a program that has been successful in reducing alcohol use. And I'm not going to bother with an education outcome because I want an alcohol use program. We're going to continue. And then you can see that in step 2, sorry, I passed over that is step 2. Let's continue. In step 3, then, we're looking at target population types of things. So you could select by age group. I'm actually interested in an alcohol program at the middle school level, early adolescence, so I'm going to select that. But you might be a person that wanted to come in and maybe you are interested in seeing all the programs we have on our database of African that have target African Americans. So you could just select that and bring up those programs. Or maybe if you were a part of the girls study group, you might come in here and you might want to just select female only, just to see all of the programs that were targeting female only. I'm not interested in those. I want you to remember that the more things that you select, the more you're going to reduce the number of programs that are going to display. So moving on through, you could also select on program type. If you were an agency that just dealt with family therapy, for instance, you might want to come in here and see all the family therapy type programs. You can select by setting. I'm interested in an alcohol program at middle school, and I want it to target the whole population. I want it to be universal, so I am going to select that. And then we continue on through. And the last step is the risk and protective factors. And we've got these 5 domains. If you unfold it, then you see under individual, the individual risk factors and the individual protective factors. So if you'd done a needs assessment and you already knew what your prioritized risk and protective factors were, you might just go in here and completely do a search on your risk and protective factors. But again, I'm interested in a program that has been successful against alcohol at the middle school level and is universal. So I'm going to display the results now, and we come up with 9 programs. Okay, so and you see then the program selector is over here to your left now as you look at these programs. So you can adjust your program selector over here. I think I want to see, also I'm interested in these same programs, but I also want to add in those for at-risk kids, selective. So if I added that category and displayed the results, it looks like I've added 3 more programs to the list. So you can go in here and delete. You could delete things. I deleted everything and just kept the alcohol in. If I display those results, it looks like I've got 20 programs that have an outcome of alcohol use that I could look at. If you're interested at this point, you kind of looked at some of this information, you kind of narrowed down what you really are interested in. You can do it like a compare here. It does not bring up any type of a matrix, but you can kind of narrow down your list. I picked those 3 programs that I want to compare. So maybe I want to open up these things and for all 3 of these and maybe print this page. So you could do that. So that in a nutshell, that kind of shows the program selector and how to use it. And again, like I say, first-time users might want to be here, but if you've done this before, it's just far easier just to go directly here to the selector and do whatever you want to to choose here as to what you're interested in. So, Brian, I think I'm finished if you want to take over now.
Okay, great. Thanks, Sharon. First of all, we're going to, as I mentioned earlier, we're going to save quite a bit of time at the end of the webinar for questions and discussion. So feel free, as they come up, to type questions into the Q&A pod there on your screen, and we'll try to go down through and address as many of those as we can at the end. So now I want to talk a little bit about what this all means in Pennsylvania, because this is a Pennsylvania-specific webinar. I'm sure that most of the folks that are joining us this afternoon are aware that the blueprints list has been very instrumental in Pennsylvania, and in fact, Pennsylvania has been somewhat unique. Originally, the original development of the blueprints list was actually funded by the Pennsylvania Commission on Crime and Delinquency, along with the Centers for Disease Control, the Federal Office of Juvenile Justice and Delinquency Prevention, and the Colorado Division of Criminal Justice. So Pennsylvania, through funding from the Pennsylvania Commission on Crime and Delinquency, actually had a stake in funding the original blueprints list. So that's a big reason why Pennsylvania has been maybe more invested than many other states in what this list means and how it can be used in Pennsylvania. Although the list has been around the original blueprints list has been around for over 15 years, Pennsylvania is really unique in how actively it has encouraged the dissemination and scale up of this list. So here in Pennsylvania, we have a really important and unique perspective. We have lessons learned, barriers identified, and resources that we've developed to really think about, now that we have this list, how can it actually be put to use to improve outcomes. The growth, here you see how the dissemination of these programs has spread from the beginning of this initiative almost 15 years ago to where we are currently, and this is just an indication of the blueprint programs that are funded specifically by PCCD. Now, the growth in dissemination that you saw was driven primarily through funding from PCCD's Office of Juvenile Justice and Delinquency Prevention, with that funding eventually written in as a standing line item in the state budget. And Sharon spoke about the needs assessment as the first step that she talked about in the tabs of the blueprint, the new Blueprints website. The foundation of this needs assessment effort in Pennsylvania was really the Communities That Care initiative, which developed a strategic prevention planning framework that allowed communities to examine local data on risk and protective factors in order to match these evidence-based programs to specific community needs. And as we saw the importance of local data-driven needs assessment to know which, if any, of these evidence-based programs might match a given community's needs, the use of the Pennsylvania Youth Survey, which grew out of the Communities That Care Youth Survey that Sharon mentioned, the use of the Pennsylvania Youth Survey became an increasingly central tool in that process. So we hope that your local schools have been participating in the Pennsylvania Youth Survey, which will be administered again this coming fall for the 2013-2014 school year and fiscal year. There are some really exciting changes in the Pennsylvania Youth Survey this year, including the fact that it will be free to any community that is interested, and it will include a Spanish version. So stay tuned for more information about these and other exciting improvements to the Pennsylvania Youth Survey, and I hope that you'll encourage your local school districts to participate in that survey as a useful way to identify the needs of your communities and then be able to match the needs of your communities to these evidence-based programs that are identified through the Blueprints tool. Now, once you've done a local needs assessment and you've determined your community's priorities, you may find that you've identified several potential programs that might address those needs. And we also have training and resources available from the Epicenter to help you compare different programs and select the one that will likely work best for your needs, based not only on the strength of its evaluation evidence, but other important factors like how well it fits your local context and how feasible it is that you'll have the necessary resources and conditions to deliver the program well and to sustain it. When we first started working with PCCD in 2001 to support the scale-up of evidence-based programs from the original Blueprints list, we recognized how challenging it could be to implement these programs with quality and fidelity and to sustain them beyond PCCD's initial grant funding period. So we recommended to PCCD that they select a reasonably sized menu of the programs they felt met the diverse needs of communities and in which they had the greatest confidence based on the research evidence. That list of programs closely resembled the original Blueprints list, with a few exceptions made for specific practical and programmatic reasons that took into consideration needs and resources that were specific to Pennsylvania. Being able to focus on a specific list of about 10 evidence-based programs over the last 10 to 15 years has really allowed us to develop significant expertise and experience with these programs and to accumulate a body of knowledge about the most common challenges to each and to develop a specific set of resources and trainings to support the scale-up of each of these programs. As more communities adopt these evidence-based programs that PCCD has targeted and endorsed, we're also able to develop and support learning communities so that communities can support and learn from each other. This has been an important part of our model and has only been possible in this context of scaling up a relatively small menu of programs throughout the Commonwealth. Now, before we get to the Q&A portion of the webinar, I want to say a little bit about where we are now and what's on the horizon, especially with these important changes to the Blueprints list that's been so central to this initiative in Pennsylvania. First, we're currently working with PCCD and the Resource Center Steering Committee, which includes other state agencies in Pennsylvania, including the Department of Drug and Alcohol Programs, the Department of Public Welfare's Office of Children, Youth, and Families, and the Office of Mental Health Substance Abuse Services, to develop an objective, transparent, data-driven process for re-examining PCCD's list of endorsed evidence-based programs and to determine whether any programs should be added or removed. The Substance Abuse Education and Demand Reduction, or SADR, funding announcement that was just released by PCCD is part of that process and will be used to identify programs for which there is local need and support. This will also be the first time that we'll actually attempt to match the list of PCCD's endorsed evidence-based programs to specific risk and protective factors and behavioral outcome needs based on the state-level data. Secondly, there's a specific effort underway to try to coordinate across state agencies in terms of the programs they support and endorse and the process that the different state agencies in Pennsylvania use to identify and prioritize these programs. PCCD recognizes that although they have their own list of evidence-based programs that they've been endorsing and that they're going to be looking at possibly adapting that list, the Office of Children, Youth, and Families within DPW, the Children's Trust Fund, the Department of Drug and Alcohol Programs, and other Commonwealth agencies also have lists of programs that they endorse. So we're trying to establish better coordination across these agencies so that there's a common message and so that we're making the most efficient use of scarce resources in the Commonwealth. Finally, PCCD has always acknowledged that even when they name and endorse a specific set of evidence-based programs such as the Blueprints, that is not meant to imply that those are the only programs that are effective. This is why, through SADR and other funding mechanisms, PCCD also supports programs that aren't on the EBP list. And while it isn't possible or realistic to think that we could conduct randomized trials or even strong quasi-experimental studies on a large number of programs to increase the number of programs with strong empirical evidence, PCCD has recently begun an initiative that will allow non-evidence-based programs to be compared to the characteristics of evidence-based programs in order to make a reasonable prediction about whether the program is likely to be effective. Importantly, this process will also generate program improvement recommendations and technical assistance to strengthen programs and increase our confidence that even programs without rigorous evaluations may, in some cases, be quite effective. So with that, I'll turn to the Q&A section of the webinar to see if we can have some discussion and answer some of your questions about both the blueprints list, the revised blueprints list and website, and also how this is going to be used in Pennsylvania. Okay, I wanted to just, while we're waiting to see if there are going to be any additional questions, I wanted to just say a few more things about our context here in Pennsylvania. One of the other unique aspects of Pennsylvania's effort to scale up these evidence-based programs, again going back to the original blueprints list, has been the development of, through funding from PCCD and also from the DPW's Office of Children, Youth, and Families, the funding of this state-level intermediary and state-level prevention support system. So you can see that the Epicenter has these three specific functions to support community prevention coalitions, as I said, as a means to what we call creating fertile ground for these evidence-based programs, not only to prepare communities through data-driven needs assessment to identify which evidence-based programs they might be the best fit in that community, but also we found that the use of these community prevention coalitions also increases the likelihood that the evidence-based programs will be implemented with high quality and fidelity, and that they will be sustained long term. So communities that have this Communities That Care coalition infrastructure in place are not only better prepared to select evidence-based programs and utilizing this blueprints list and website, but also more likely to make sure that those programs are well delivered and sustained long term. And then this piece over on the right-hand side of the screen I mentioned is about improving the quality of local innovative programs and practices that might not yet have an evidence-based. Again, realistically, we can't expect to do a randomized trial or even a strong quasi-experimental study of the vast number of programs out there that might be effective but for which we don't have any evidence. But this is a way that PCCD is supporting and promoting to still acknowledge those programs that are in widespread use, to assess whether or not they're likely to be effective, and to provide some recommendations and technical assistance to strengthen those programs so that we can have greater confidence in them. So it's an important acknowledgement by PCCD that the evidence-based programs that have undergone rigorous evaluation are not the only programs that might be effective. They're just the programs for which we have the greatest confidence. And that brings us to this graphic that we've developed to display the fact that every program and service that's out there can be placed somewhere along a continuum of confidence with any infinite number of points. So rather than thinking of all programs and services as either being effective or ineffective, either being evidence-based or they don't work, we want folks to think instead about any program or service can be placed somewhere along this continuum of confidence. And even the blueprints programs aren't all exactly in the same place on this continuum. Some, even within the blueprint model programs, there's some variation in the strength of evidence, the number of studies, and so forth. So it's really important to keep that in mind because it really reflects PCCD's vision for how to promote the increasing use of not only evidence-based programs, but programs that have varying levels and types of evidence of effectiveness. Okay, so we have a question about what kind of support we provide to agencies, and if you go to our website, which is www.epicenter.psu.edu or epicenter.org, you can see that for the if you go to the evidence-based programs tab on our website, you'll pull up the list of the original 10 model programs, model and promising programs that PCCD has been endorsing for over a decade. And if you click on any of those, you'll pull up some of the types of resources that we've developed. And again, these are resources that we've developed based on working with grantees who've been funded by PCCD and other state agencies over a number of years. And in working with those agencies, we've identified some of the most common barriers that they experience, barriers related to adoption and uptake and implementation, but also barriers related to things like recruitment or sustainability or communicating and assessing and communicating the impact of these programs. So for each one of the evidence-based programs that we've been supporting, which you see here on the right side of your screen, we've identified and developed a number of different resources. And those resources, again, they vary from one program to the next based on the individual barriers and needs that have been identified for that particular program. So we have another question about how programs and communities can access the Epicenters support system. And that's a great question, because originally the technical assistance that we provided was geared specifically towards communities and agencies and schools that were funded by PCCD and had a current grant. But with the development of the Epicenter starting in 2008, the state put in a significant amount of additional resources, and we're actually able to provide technical assistance to any school or agency or community that's interested in pursuing any of these evidence-based programs, or even interested in developing the kind of community capacity to assess their local needs or to examine programs that aren't evidence-based. So there's lots of ways to contact us here on our website, by phone or by email. We're on Twitter, we're on Facebook, and I encourage you to follow us on Twitter, like us on Facebook, sign up for our email listservs. We have a variety of different digital newsletters that we send out related to these different programs. Some are general listservs that provide information generally on all of the programs, or on prevention science and evidence-based programs broadly, and others are related to the specific programs that we support. And obviously, as I mentioned, with this new initiative that PCCD is beginning to re-examine the list and possibly add new programs to their list of endorsed evidence-based programs, we'll certainly be adding resources and technical assistance to support any new programs that get added to the list. Okay, so we have a question: how do we determine whether the prevention curriculum that are being implemented in our county are where they're placed along this benefit versus harmful effects continuum of confidence? Well, if the curriculum is something that has been evaluated, it will and has been assessed by the Blueprints website, you can, first of all, I would suggest going and searching for that program on the Blueprints website. There are also a couple of other really common online registries of prevention and intervention programs, including NREP, the National Registry of Effective Programs and Practices, and another website called crimesolutions.gov, and you can search for a particular curriculum on all three of those websites to determine whether or not it's been reviewed by any of them. If it hasn't been reviewed by any of them, you can feel free to contact us here at the Epicenter, and we can probably do a quick search and give you some feedback about whether there has been any evaluation done on that particular program or curriculum, and where we would suggest that it would probably fall along that continuum of confidence. So there's a question: if a school is delivering a homespun program, a locally developed program, and they want to explore its effectiveness, can the Epicenter provide assistance, or is it limited to certain programs? The assistance we can provide is, as I just described, we can summarize whether existing research has been done on that homespun program. We could likely give some advice about how to structure an evaluation of that program if one hasn't been done. What probably falls outside of our capacity would be to actually conduct an evaluation of that program, but we could give you advice on how to structure such an evaluation, and possibly try to connect you with someone locally who might be able to help you out in conducting an evaluation of that program. But even if a program or curriculum hasn't been evaluated, we can give you advice about what kind of things to look at in the program to determine how closely it might match to other similar types of programs that have been evaluated and found to be effective. Okay, I don't see any other questions, so I think we'll wrap things up. We've recorded this webinar, and we'll be posting it on our website soon, along with a list of some useful resources, some resources that we've already identified and some that we've shared today, and some new resources that we're in the process of developing. For example, some resources to help folks understand what is a randomized controlled trial, what is a quasi-experimental evaluation, and why are those two types of evaluation important in, for instance, the criteria that the Blueprints has selected for identifying the programs that they're endorsing here. So we'll have those resources as well as the recording from this webinar up on our website shortly, and if you have any additional questions, please feel free to contact us either by phone or by email or through Facebook or Twitter. Thank you, and thanks to Sharon Mihalik for joining us today. Thanks, Sharon.